Fellow healthcare worker, you are invited to take part in the Crown Coronation trial. This trial is conducted by the Crown Collaborative, an international group of hospital and community-based healthcare workers and researchers who have come together to counter the attack of COVID-19 on the global healthcare workforce. Crown Coronation is a platform trial designed to assess emerging pharmacological strategies to prevent symptomatic COVID-19 and to mitigate severity of COVID-19. This design allows the trial to add and remove interventions as evidence emerges. In other words, when we become aware of a new promising intervention, we can add it to the platform. Also, if evidence emerges that an intervention in the trial is clearly beneficial or clearly not useful, we can remove such interventions from the platform. Practically, this means that participants joining during a certain period in the trial may be randomized to different interventions from participants joining at an alternative period in time. Crown Coronation is a randomized control trial, or RCT. Randomization means that participants don't get to choose which interventions they are getting in the trial. Rather, a computer assigns new participants to one of the groups in the trial. Flipping a coin to make a decision is an example of randomization. Crown Coronation is a placebo-controlled trial. During the trial, a fraction of participants will be assigned to a placebo. With the term placebo, we mean a pill or injection that looks like the active intervention but does not contain any active ingredients. This is necessary to prove that the active ingredient actually works. Without it, we cannot find out for certain whether the active ingredients are any better than current standard of care. The intervention period in the trial is 2 months. We will measure the effect of the intervention after 2 months and after 5 months. Some interventions, like vaccines, may provide long-term benefits, and participants assigned to these interventions may be followed up for a longer duration. Participation in the trial includes the following. The enrollment procedure is online, so you can do it at a place and a time that is convenient for you. Once enrolled in the trial, you will have to go to a collection point at your place of work to pick up your trial kit. Some sites may make other arrangements to get the kit to you. If you are assigned to a vaccine intervention, you will be given the vaccine at the time that you collect your trial kit. The kit will contain any pills you need to take, a COVID-19 test swab should you need it to test yourself during the trial, finger prick blood testing kits, and information on how the procedures in the trial work. There will be no routine in-person follow-up during the trial. You will be sent SMS text messages on your mobile phone asking you about symptoms or problems once a week. Trial doctors may at times call you in order to clarify symptoms that you report and answer questions that you have. If you develop symptoms consistent with COVID-19 while in the trial, you will undergo real-time polymerase chain reaction, RT-PCR, testing for SARS-CoV-2. This is a nose or mouth swab test. A small portion of those who have COVID-19 initially test negative. If you have a negative test at any time, you should still take every precaution not to spread infection to others. Also, should your symptoms worsen and you need hospital care, your treating doctors should repeat the test for SARS-CoV-2 if your previous test was negative. The exact procedures in the trial will vary slightly depending on the country that you're in. Crown Coronation is not a treatment trial, so you will not get any additional medicines apart from those you have been assigned to in the trial. You should consult your usual healthcare provider to seek care if you develop COVID-19 in the trial. Various treatment trials are underway around the world. We will provide you with information about these trials in your area. Depending on which intervention you have been assigned to, we may ask you to discontinue the trial medication if you test positive for COVID-19.
The Crown Coronation trial focuses on healthcare workers and is not open to the general public, at least not at the beginning. We exclude people under the age of 18 years. You will not be able to take part if you have already had COVID-19. To take part, you need access to the internet to complete the online enrollment and informed consent procedures. You also need your own mobile phone since most of the data collection will take place via SMS text messages. If you have a known allergy or contraindication to one of the interventions in the trial, you will not be randomized to that arm of the trial. The online registration procedure will go through these points step by step to confirm that it is safe and appropriate for you to participate. We don't know for certain that any of the interventions will protect you. That is why the trial is necessary. Also, while you are in the trial, you will not know whether you are taking the active medication or a placebo. For these reasons, it is important that you continue to practice social distancing and use recommended infection control measures that include appropriate use of PPE while you are in the trial. You will not be paid for your participation in this research. The trial is designed to minimize the effort of participation. You will not have to pay for any tests that we do in the trial. We use reverse billing so you don't have to pay for the SMS text messages that you send to us. You may benefit from participation because you will be linked to a data monitoring team that tracks your symptoms throughout the epidemic. You will have access to the latest true information about COVID-19 through the resources on our webpage. There is a chance that participation may increase your vigilance or awareness of risk, which in itself may reduce your risk of getting infected. We ensure that you will be tested for COVID-19 if you develop symptoms. If you are diagnosed with COVID-19, we can provide you with information about ongoing COVID-19 treatment trials. If you get ill during this trial, our doctors will remotely monitor your well-being. The website includes details on the interventions that are currently being tested in the trial. Specific contact information for the investigators in your country are available on the country-specific pages on that website. The website also contains the link you need to register for this trial.
Thank you for taking the time to watch this information video on the Crown Coronation trial.